Hi, welcome back. We're here today with Kim Martinez. Kim is a friend of Robin's. They met during a liver support group, I guess you would call it, Kim. Is that
hmm
accurate?
Yeah, online.
Okay, online, yes, as so much of our lives are these
hmm
days. And Kim herself is a liver recipient and a transplant advocate. So we're here to talk with her about the hurdles she had to overcome in order to get her liver and what she does to help other people who are on this journey. Hi, Kim.
Hi, how are you?
Good. Excited
Uh,
to hear your story.
okay, where would you like me to start? Because it's a long story.
Right. I think there's a couple things that really come to mind. One is I'm really interested in hearing about when you realized the gravity of your illness and that you needed to go down the transplant path. Sort of what happened? How did that happen?
Okay. Well, before I knew I was sick, I was actually changing my lifestyle. I joined Y and I was trying to get on a healthy path. I wanted to be a living kidney donor for my older brother. And so like 7 months, I was going at it hard. I was swimming laps, I was doing Zumba, I was riding bikes, I was taking my dog for walks. And 7 months later, I had lost a bunch of weight and like 96 pounds. And I woke up sick. And I thought it was a flu. Felt like the flu. Later that evening, I threw up and it was blood all the way to the top of like a 32-ounce drink cup. And my brother came home from dialysis and said, "We're going to take you to the hospital." And of course, I dragged my feet. I didn't want to go to the hospital and ended up there. And they called in a gastroenterologist and he did a procedure to stop my bleeding. What happened was I had what they call varices in my throat. And what happens is the blood can't pass through a scarred liver. And so it made its own way into the more delicate veins in my throat, and they couldn't handle it. And I would vomit. It would bleed, go down to my stomach. And then when my stomach was full, then I would throw up. And that's why it's so dramatic. When you throw up blood, it's just a lot of blood because your stomach was full of it. Um, yeah, I had no clue I had any liver issues. I was taken care of that night in the ER and they told me I had cirrhosis. And at the time, I didn't know it was end stage. My brother talked to the doctor in the hallway, and he told my brother that I would need a transplant. I didn't know that the
Wow.
first
From
night.
the beginning, like
Yeah,
literally you were symptomatic and went straight to
yep.
getting a transplant.
One day I was swimming laps. The next day I was in the ER.
Wow.
So yeah, it sneaks up on you until you just can't handle it anymore. My transplant surgeon actually calls it falling off a cliff. You can put up with so much and then just one little thing can push you off the cliff. And the last thing in the ER before they put me under to take care of my bleeding, last thing he told me was, "Oh, by the way, you do have the flu." And I said, "Lucky me." And that's what pushed me over the cliff was the flu. Yeah.
Interesting.
Yeah, so that was December of 2013. First time I heard that I needed a transplant was February 11th, 2014. I had a follow-up with the same doctor in the emergency room, and he said, "So would you like to have a transplant?" And at the time, I just told him that's like you asked me if I want to go to the moon. How was that ever going to happen? And he said, "Well," he said, "with my help and you behaving yourself and being compliant, we could do it." So from February 11th to 2014, all the way to February 11th, 2016, that's when I was transplanted. 2 years to the day.
Wow.
Yeah. And I was lucky. I had a very good gastroenterologist that helped me every time I had an appointment at the transplant center. I'd come home and have an appointment with my local gastroenterologist, and he kept track of them. He kept track of me. And if they were like slow to do something, he would let them know, "Hey, what's going on this case. And he actually wrote me a reference letter telling them that I would be a good candidate for transplant in his opinion. So I think that really helped me. And
So let me interject really quickly. Were you having regular physicals and blood work up until this point?
no, I did not have insurance. So
Okay, so that's what I
yeah,
wanted to get to. So do you
yeah,
feel that preventative measures could have been taken had you been having regular health care?
yeah. Most probably because most people who get they say you have a liver problem. It's an incidental finding. Most diagnosis, like you'll go in for gallbladder surgery and they'll say, hey, your liver looks kind of wonky. They'll go in and some people say, hey, you got cirrhosis. We saw it when we did your gallbladder surgery. Some people find out when they get a CAT scan for something else, something completely different. Most liver diagnosis is incidental. So one of the things I want to do as a liver patient advocate is I want to make sure that when you have your annual physical, you ask about your liver health. It's just a blood test. It's a
Right.
blood test. And if you do it every time you go to the doctor, like every year for your physical, over the years, they'll see a trend and then they'll stop and say, hey, and another thing about that is when they do find fatty liver, a lot of times they brush it off as no big deal. And they need to inform the patient what it could be if it progresses.
And is that reversible with proper care?
Early stages, yes. Yeah. And it's mostly diet. I mean, it's diet and exercise in the early stages. Yeah. And later stages, they only have they only have therapies to control your symptoms and not even control them, just try to prevent them. Like for instance, low sodium helps you keep you get ascites, which is a fluid buildup in your stomach. Some people will actually look 9 months pregnant. Their stomach is so,
Wow.
yeah. And if you're on a low sodium diet and you're on diuretics, that's the therapy. They don't have anything to actually, cure your fatty liver or cirrhosis. All they have is way to control your symptoms. And control is, I mean, that's a silly word. They try to prevent them.
Right.
So,
Right.
and you can get confusion from toxins that build up from your liver. Not your liver does so much, and one of the things it does is takes care of toxins. So if it's not doing its job, those toxins go to your brain, and then you get confusion, and you can actually end up in a coma. And people have died being in. It's called hepatic encephalopathy, HE, and people have died from HE comas.
Wow.
Yeah.
So tell us what your journey was like from being diagnosed to hearing that news and then having to go through the process of getting insurance, getting approved, and finding a donor.
Okay. I didn't have insurance. I didn't think I was going to ever be able to get insurance. But luckily in December 2013, right on the horizon was the new ACA, Affordable Care Act. And I didn't think I'd be able to get that either. I had no idea who could get that. So I have a niece and she stuck her nose in and she found out and she got me policy. She told me about this policy with help from family members. I was able to get insurance through the ACA, good insurance. And then when I showed up to my first follow-up appointment, I gave him my insurance and he told me that I said, how am I going to get a transplant? And he said, well, now you have insurance, you can. So if you don't have insurance, as far as I know, as far as my experiences are, I think you just can't get a transplant.
Right.
So I was lucky. I have ACA. I had ACA at the time. It paid for my transplant. It even paid for one of the more expensive medicines a lot of patients can't afford called Xifaxan that helps with HE. It's real expensive. And if you can't have Xifaxan, they give you something called lactulose. It's a real thick syrup that you take and it helps the toxins bind with your bowel movements, and that way you don't get HER. You try to control it. It's not 100%, you know.
Right.
So
And
yeah.
do you have to go? I know from Robin's interview that she's been through a lot of various testing and almost like interview process to determine her qualifications if she's a good candidate for a liver transplant. Did you
Yeah.
have to go through all of that? And if so, what do you feel nudged you over the edge that you were accepted?
I really think my gastroenterologist wrote that letter, and I gave it to him my first appointment. Okay, I'm going to go back just a little bit. I was going to the transplant center for almost a year, and I would come home, and my gastroenterologist was, "What's going on up there?" And I tell him, and he'd say, "Huh, you check every box. I wonder why." He goes, "You know what? Sometimes I call up there and ask about my patients. I'll do that." So he called up there, and I don't know what he said, but the next time I saw them, they said, "Hey, would you like to be evaluated for a transplant?" And I said, "Yes, please." And they said, "Okay." And they gave me a folder, and in the folder on one side was information on what to expect, the tests. I had all these tests, and on the other side was clearances. I had to get several clearances, including a dental clearance. And of course,
Dental?
I didn't have, yeah, dental. Yeah, you have to get dental clearance. You have to have all the vaccines. I was pre-COVID, but now you have to get all the COVID vaccines. I had to get hepatitis A vaccine, hepatitis B. They don't have any for C. Anyway, I had to get all these things done. And they gave me in this folder the forms to fill out and have faxed back to them. And then I told them, you know what? I'm getting ready to go visit family in California. I could cancel that and I could stay here and go through the first part of the evaluation. And they said, no, you need to see your family. So they sent me on my trip, and they gave me a form for my family to fill out. It's called support. And I had to get everyone's name listed, their phone numbers, and what kind of support they were able to give me, as in transportation, financial, running errands, um, actually being there taking care of me for the first, for the first while after transplant. So I had like 15 or 20 names, but these people are all in California, you
Right.
know. And I had two people here, and my sister, who has a husband in a wheelchair, newly in a wheelchair, and my brother who's on dialysis.
Oh my goodness.
Yeah, and my mom at the time who's 90. That's who I had. Yeah, but I gave them a list of everybody because if they really had to, they could fly out and help me.
Right.
So my first appointment with them, I sat down at a round table and they brought people into me. I think the first person was my coordinator, pre-transplant coordinator. And she kind of said, this is what we're doing today. We're going to talk to a financial person. We're going to talk to a counselor, a social worker, and then you're going to see the surgeon. So that's what I did. The financial lady, she was very helpful. She gave me she went over my insurance and told me what it covered, what it didn't cover. It didn't cover lodging after, it didn't cover transportation. So I called my brother in California and I said, hey, Jimmy, would you help me with the lodging? And he already told me he would. And he told her yes, anything that I needed after transplant as far as lodging, he could handle. So she clicked that off. And then she looked at my sheet with everyone's name on it. And she said, okay, I got support. If you don't have support, you can't have a transplant.
Wow.
Yeah. So a lot of people will tell me, well, I don't really have anybody. And I say, well, do you have
Don't
a
say that.
church? Yeah, I really do want to say that. I said, do you have a church? Because a lot of people have a church family, and churches,
Right.
especially around here in Oklahoma, they're small churches, and they'll have people that step up and help.
Right. For sure.
So I tell them, just, you got to ask. You can't be shy. You got to ask.
Yeah.
So if you don't have support, you can't have a transplant. If you don't have a way to pay for it, you don't have a transplant.
I remember when we first spoke with you, you said one of the first questions you were asked is, "Are you fundraising?"
Yes. Yeah.
So,
The financial lady, I don't know if it was the first question, but yes. She said, "Are you fundraising?" And I said, "No, I'm not. But my brother Jimmy, he started me on one, and I didn't get a whole lot because the people that really gave me money was friends of Jimmy. You know, his connections. I don't know anyone with money, so yeah, I told her yes, and I didn't know she was going to ask that. I knew that other people had fundraising, but I didn't know that was actually part of the interview.
right.
So I said, yes, I do. And I told her who it was with. It wasn't with GoFundMe. I think it was called Pay It Forward or something.
Right.
So I had a little bit. And um, I mean, I've heard from other people, and it's common for them to ask if you're fundraising.
Right.
And there's places that will help you. Like I might be wrong about the name, but it's NFT. They'll tell you about this place, and it's for transplant patients. And
Mm,
it's like a little personal ad. You know, this person needs your help, blah blah blah,
right.
and you can use it on your social media. Their little blurb about you.
What would you say, speaking of funds, what would you say the annual cost of maintaining a transplant is? And
Yeah.
because I know, I think that there's this misconception that you get a transplant and you go on your way, but I know you have to keep on the anti-rejection meds
Hmm.
forever, as far as
Hmm.
I know. And I want to know how it impacts your daily life, A, and B, what would you say that the annual cost per person is to
Okay.
stay healthy?
Okay. I've been told if you don't know the answer, don't guess. So I'm not going to guess how much it is, but I do know transplant life is expensive.
Right,
And it's just I have good insurance now, and I'm really lucky a lot of that stuff. But in the beginning, when I sat down for that interview with the financial lady, she gave me sheets of medicines and how much it costs, and how many medicines you'll have for the rest of your life.
right,
I have tacrolimus, which is also called Prograf, and I have myofenmic, and I'm pretty lucky. And I have a couple, those are my major anti-rejection meds. And yes, I have to take them the rest of my life. And some people don't realize that. I had people ask me, so you don't have to take any medicine anymore, huh? And no, the opposite. I
yeah.
have to take a lot of medicine, but not near as much as in the beginning. They taper off a lot of stuff. So
Oh,
you
I
really
didn't
need to
know
look
that.
up how much it costs average, because if I told you, it would be wrong. And I really
Right.
wanted this to be accurate. So
What happens to someone, and this is more of a question for the advocate, you, not the
mhm.
recipient, but what happens to someone if they do get a transplant and then they lose their insurance?
Okay, I have a friend. She's actually the president of Trio. Her name is Lauren Davis. And right now she is working very hard on a campaign called Honor the Gift. And it's to help people once they've been transplanted. I think you can get 3 years of help with your medicine on Medicare after transplant. And then after that, it's up to you.
Wow.
So yeah, there's legislation she's working on for that. So
That's
yeah,
it's kind of insane, right?
yeah,
That you would go through all of this and then you can't afford your medication.
yeah. And another thing she's working on is, and I think we've made some headway with this, is living donors. If
Right,
you have a living donor and you find one and they live way across country, they have to take off work, they have to
right,
travel, all this stuff. They don't get any reimbursement for it. Now they're starting to make headway where they can get some money reimbursed. I mean, it's a financial burden on them, and
right,
and the recipient's not allowed to pay for anything. So yeah, because it's like it's considered like buying an organ or
oh
whatever.
my god.
So
Okay.
yeah, there's a lot of things that just don't make much sense. So,
Yeah.
but Lorinda and people like Lorinda are working on it. So
That's crazy.
yeah,
That's
yeah,
crazy.
it's
I think
very
this
crazy.
problem is, while not exclusive to the United States, it's definitely an American problem because I know a lot of countries. For example, I had a relative who's French, and when they got brain cancer, everything was covered. They
Hmm.
didn't worry about anything. In fact, the government paid his salary for 6 months while he
Wow,
was in clinic.
wow.
So I know that this problem isn't exclusive to transplant recipients. It's
Mm-mm.
sort of everyone that's sick.
Hmm.
What do you see happening? I know the ACA has really helped a lot of people. There's
Hmm.
talk among some candidates of repealing that.
Hmm. Oh,
Um,
I used to hold my breath every time they started talking about that. I was like, how many? I have I don't want to talk about her. Anyway, yeah, every time anything like that would come up, I was like, I don't know what I'm going to do if that happens. I don't know what I could do because I would be lost. And one of the, you make it's not an actual physical contract, but you make a contract when you go in for transplant that you're going to take care of this organ. You're going to do your best to take care of it because someone else gave it to you. It's a precious thing. And so when you need help to take care of it, and it's not like you don't want to take care of it, you want help to take care of it. And it's just kind of like you're there you are by yourself. And it's I don't know. It's just really it really makes me sometimes emotional about that.
I bet.
Yeah.
Yeah. Yeah.
It's like yeah, it's like you have a kill switch in you.
Right.
And if you just let up on it, that's it. I mean,
Right.
that's it.
Yeah.
So
I
it's
would say that healthcare or lack thereof is probably that, and education are probably the two biggest challenges we face in this country right now.
oh yeah,
Do you feel that they're symbiotic? You know, the more people that are educated, the more people will act.
yeah,
Do you feel like there's stuff that you or we could be doing to make sure that the ACA stays in place? And also, what needs to expand? How does that need to
yeah.
expand?
I'm not well versed on that, but as far as the ACA goes, it's already done so much good.
Yeah,
A lot of people say, "Well, I can't afford it. I can't afford it." Well, a lot of people can't afford private insurance.
yeah,
So, it just it doesn't make it so everyone has insurance, but makes it so a bigger group of people can have insurance. And
right,
then we should all help the people who can't get insurance. I
right,
mean, we should all be in this together. We shouldn't say, well, you got it, so I don't want you to have it because I can't have it. I mean, we
right.
should just be helping each other.
Right
So, and
there is like
yeah,
the tagline for medical insurance, I think,
yeah.
you know?
I mean, I mean, I don't know if this will make it in or not, but I used to hit thrift stores a lot. When I was sick, I was dropping weight really fast. So that's where I get my clothes. Cause I mean, I lost 45 pounds in like 2 months once. So, and I'd be at the register and the ladies talking about they're getting ready to repeal ACA. Today's the day. They're talking about it. There's Congress is meeting, blah, blah, blah. And it's about the third day I heard this. And I said, what does it hurt you that someone has insurance? What does it hurt you that someone else has insurance?
Yeah,
And she was real quiet all of a sudden. So
yeah,
I just don't understand that. Why do people care if other people have insurance?
yeah. Well, and like you said, we're all in this together. We should want everyone to have it. Everyone should
Yeah.
have healthcare. It's a bigger burden on society to have sick people than it is to have well people. And that
Yes.
goes for
Yeah.
physical, mental, any kind of ailment.
Yeah. So.
So,
But it's been I'll be 8 years out of transplant February 11th.
wow.
Yeah,
Congratulations.
thank you.
Is there
Yeah.
anything you'd like to say about your advocacy work?
I'm pretty busy at home, so I do as much as I can. My friends do a lot more, like Lorinda. She's amazing. You really should interview her.
Yeah.
Um, but I love it. I I remember when I was first diagnosed, I remember thinking, I can't believe this is happening to me. I had no idea. Doctor never told me I had NASH, and we haven't even used that word here today. But that's what I had. I had non-alcoholic steatohepatitis, and that's liver disease where you don't even have to be a drinker. I wasn't a drinker, and I learned from my discharge papers that they said I had NASH.
And that's
Um,
genetic, right?
yeah, it can
Yeah.
be. Yeah, yep. And so I like for them to know about NASH.
Yeah. Yes, actually, and you just touched on something too that Robin has brought up several times, which is liver disease seems to have a stigma. It's a
Mm-hmm.
and people make a judgment on what they assume your lifestyle was if you
Mm-hmm.
have liver disease. And it's important that while yes, people that abuse their liver get liver disease, people that don't abuse their liver get liver
Mm-hmm.
disease as well.
Mm-hmm. Yes.
And talk a little bit about dealing with that stigma.
Okay. That stigma put me in denial. That stigma put me in denial. So that stigma doesn't just hurt the person with alcoholic liver disease. It hurts everybody. Because when they told me I had cirrhosis, I said, nope, I don't have cirrhosis. Nope, my dad had cirrhosis. My dad passed away from cirrhosis. That's not me. So I just knew they were wrong because I had the flu. And
Right.
I did have the flu. So, yeah. So when they put NASH on my discharge papers and I started looking it up, and I found out you can get liver disease without drinking, then I started thinking, okay, well, maybe. So, yeah, that stigma, it's a double-edged sword. It hurts the person that drinks, it hurts the person that doesn't drink.
Right.
So, yeah, and they're changing the name of NASH to MASH, and the stands for metabolic. They're getting
Oh,
rid of that because of the stigma. Yeah,
interesting.
yep. And NAFLD is going to be MAFLD, MAFLD. Yeah,
Okay.
yep. And that's a new terminology. So
Gotcha.
that's another thing that's kind of tripping us up because everyone's used to the old words. Anyone who knows about it, but anyone who doesn't know about it, the mash and maffled, all that will be brand new to them. They won't know any difference. So
Right, right,
eventually we'll have everyone saying mash.
right.
So one of the recommendations when we were talking about changing the names because the stigma was we should say MASH, formerly known as NASH, like Prince.
Right? At least people it'll resonate.
Yeah. It's like, oh, okay, now I understand
Uh-huh.
what they're trying to say.
Exactly.
Yeah, yeah.
But again, it seems like if everybody had access to just basic health care,
Mhm.
so much of this, like you said, this could have been caught way before you got to that point.
Oh yeah, yeah.
And
Because I really didn't have any noticeable symptoms. I mean, now I look back and I was losing weight too fast, even though I was doing all the stuff to lose weight. I was losing it too fast. And that was because I was sick
right.
and I was tired all the time. But I thought it was because I was helping
You
my
working
sister.
out.
Yeah, I was working out. Plus, my sister and her husband, he ended up in a wheelchair. He ended up in the hospital and in a little town, and he had an infection, and they couldn't find it. And his from his toes all the way to his like stomach, he started slowly getting paralyzed. And they wouldn't. And finally, my sister took him to the bigger hospital, and they found it just before it stopped his breathing. She caught it. Yeah, they said this is it. There's an infection in your spine, and
Oh,
they stopped it just before they caused his diaphragm from being paralyzed. Otherwise, he'd be on a breathing machine right now. And
wow.
so at that time, that was the same. Like that was right after Halloween, the same year, 2013. And that whole month, I was driving to Claremore and back, taking her to rehab to see him. And it was cold, it was miserable, and I was exhausted. And everything that I was experiencing, I put down to exhaustion.
Exhaustion. Sure.
Yeah.
Sure.
So, everyone lives their life. Everyone has things they have to do. And
Right.
if you start being fatigued, then you just write it off as something.
Sure.
So, yeah, I didn't know until I threw up blood that something was really wrong with me. I mean, I'd go to swimming in shirt and shorts. I don't wear a bathing suit. And I had my shirt and shorts on and getting ready to go to the pool when I woke up sick. And I mean, I could have been swimming that day. I mean, it was just like a light switch. I was fine, and then I wasn't.
That's
So,
crazy.
yeah, it's really crazy. And I asked the doctor once why that happens, and he said that's just the way it is.
There's a tipping point.
Yep. Yeah, it's like the last straw,
Right. Right.
Yeah.
So let me wrap up a little bit. I know that you're super familiar with Robin's story.
Mhm.
We've interviewed her for this show, and she's part of the production team. You're familiar with her journey. What words of advice or encouragement would you have for Robin and anyone in this position where they're stagnated in the transplant process?
Okay. Robin really is already doing what I would say. She's advocate. I mean, she's her own advocate. And that's what I would say. I say, be your own advocate. Just like me, if you run into walls, you just got to keep hitting your head against and maybe turn and do something else. But you just have to be your own advocate. When I was sick, I would do labs, and I would get copies of my labs, and I would mark them up. I would look up words I didn't know. I'd have a list of questions. When I went to my appointment, I would put it out. Not keep it in my pocket, put it out, because a lot of times you get caught up in what they're saying or doing, and then you forget.
Right.
So I couldn't leave that room until I opened that, and he got to know me like he knew. So, and I'd have him answer all those questions. And I was so lucky. I had a great gastroenterologist. He would answer, and it wouldn't be yes or no. He would give me details, and he would explain things. And I remember one time we were talking about some medicine I was taking, and I was saying the generic name for it. And he goes, "Oh, I think you're wrong. I don't think that's right." And I said, "Oh, okay." And I knew I was right. He goes, "Let me look." And he looked it up. He goes, "Oh, yeah, you're right." And that's the kind of doctor that you need, because, he's not full of himself. He's not going to say you're wrong and then later on find out that. And so he looked it up right there and then. He also, I don't know, he's always late. And that sounds terrible, but that's the kind of doctor I want, because he's giving extra time to the patient before me. And he's
Exactly.
giving me that time. Yeah. I
Yeah.
saw him not that long ago. He came in on time. He goes, "Look, I'm not late." I told him, "I don't mind when you're late." Yeah. So he's a really good guy. And all my doctors, the ones at the transplant center, every single one of them. Oh, I can't believe how lucky I was to get this group of people to look after me. I mean, every single one. 10 months out of transplant, I had an issue with my donor, where they sewed me and my donor up together, the bile duct. The scar tissue closed my bile duct off. Yeah, 10 months out. And I was in the emergency room at the transplant center, which is a 2-hour drive to the emergency room. Oh, yeah, it was the worst drive ever. And I get there and they take care of me right away. They get me in the back room right away. And my transplant surgeon, and I have like 3 of them. 2 of them, they weren't in the emergency room. They're in their offices working, but they made time to come by and check on me in the emergency room. Yeah, I remember one of them. I was cold. I was so cold. And he came in and he started asking me how I was, blah, blah, blah. And then he reached for my shirt and I said, "Oh, okay, he wants to see." So I pulled my shirt up. And he said, "No, I'm just trying to cover you." He's trying to make me warm. I said, oh, okay. Yeah. But I knew he was on his break because he had his Coke with him.
Aw, that's so nice, though.
Yeah, they're
Yeah.
really great. I have the best transplant team ever. She's no longer a coordinator, but my first coordinator, my first post-transplant coordinator, her name is Kelly, and she is the best. I mean, anytime I had any problems, she was right on top of it. Yeah. Yep. In fact, that day I ended up in the emergency room, she was texting me, "How far are you? Where are you? I'm at such and such exit." Okay, good. Okay, I'll be there. And she was right there in the emergency room waiting on me to
Nice.
come through the doors. Yeah.
Nice.
Yeah.
Yeah.
I don't know how other hospitals do it because this is the only one I've ever had any
Right.
dealings with. But I'm telling you, if you need a transplant, you need to go to Oklahoma City. Yeah.
Well, touch wood, I don't have to, but
No, but the people listening to this,
yeah.
yeah, they're just amazing. I
That's
mean,
great.
I'm 8 years out and they're still amazing. I talked to my coordinator yesterday, another one. Kelly actually still works there, but she's in another position. But anyway, I was talking to him yesterday, and I said, I'm the one who never gives you any problems because I haven't talked to him in so long. And we were talking, and he's doing good, and he says, "You're doing pretty good." I said, "Yep." And then I was telling him about I already have my thank you cards made. I send them thank you cards every anniversary.
Nice.
Yeah. So I said, I already have my thank you cards, and they're going to be mailed in a couple of weeks. And he said, "Oh, we look forward to those every year."
Aw.
Yeah. Yeah. So
Nice.
I think there's something to be said for smaller hospitals.
Yeah.
Yep. You don't
Well,
get lost.
yeah, because you don't get lost in the shuffle. You actually get care.
Yep. Yeah. Yep. I wish I
So
could say their names. I can't say their names, huh?
I don't know why not.
Okay. Okay. Dr. Duffy. When I got the call, Kelly called me up, and that's the first time I ever spoke with Kelly because she's my post-transplant. And she said, Kim? And I said, yes. And she said, Dr. Duffy thinks he has found you a liver. And I said, and then she told me all where I should go and stuff. And I said, can you repeat that? Because I didn't hear any of it. And she did. And Dr. Duffy was my main surgeon. And Dr. Coley, I think he's the head of the whole shebang at Integris in Oklahoma City. Yeah. Dr. Coley, he was the surgeon that actually worked on my liver, my new liver. They have to get it ready to be put in on the back table in the OR. I'm pretty sure that he's the one who did that. And he was in surgery with me. And then Dr. Kautzman, she's in Texas now. She's a pretty wonderful person too. And just everybody at Integris. I had a critical care doctor. I had low cardiac output like the first day where my heart wouldn't pump until it like started shaking. I don't know exactly what they call it, but it was low cardiac output. And he was the one who brought me back in the ICU. Wow. Yeah. So, yeah, a lot of good people out there. And a lot of good nurses. So,
yeah.
Yep.
Yeah.
I wish everyone could have the
Underappreciated
care I
is
had.
that, like teachers, I think the medical people are often underappreciated.
Yes.
Not the bureaucrats, but the people actually doing the work.
Yeah. I wish everybody could have the care I had because I have no
I do
complaints.
too.
Yeah.
I do too. Yeah.
Yep.
So I'm going to ask Robin if she has any questions she wants to hop in with.
Hey, thank you. This was beautiful. It's really nice to be able to go from a horror story to a decent story.
Yeah.
And it gives us all hope, everyone. And I want to thank you so much for being here today.
The United States spends more per person on healthcare than other high-income countries, but still has a lower life expectancy.
We have poor outcomes relative to other countries. We pay twice as much as any other country. We pay more and get less.
My platform was built on me talking about being in therapy and dealing with narcissistic personality disorder. I don't trust people with my information because I know I use other people's information against them.
Name brand Adderall is still available for $290 with insurance. It's the generic stuff that most people can afford that's running low. You know, you have a productivity crisis with the slowdown in Adderall and whatnot. You have a literal healthcare crisis if people can't get blood pressure medication, diabetic medication.
These institutions' board of directors gets to choose who gets a liver, who deserves one, and why.
That's a common question to ask all transplant patients. Are you fundraising?
Are you saying environmental influences rewire the brain?
Whatever we do consistently will wire up the brain. Neurons that fire together wire together.
It's usually the folks that have the highest IQ who are most susceptible to developing serious mental illness. When somebody has a psychotic break, it's like a heart attack. It's like a brain attack. It takes a long time to recover from that.
They all took an oath that said, first, do no harm. I'm really fucking angry.
The policies and regulations in place by our governments place people in a position where either they're priced out, they're not allowed to do something with medical doctors, or something that they want to do is banned. So what it does is it forces people to start doing things on their own and learning things on their own. Anybody can learn to be a medical doctor.
We're taught not to see ourselves as part of a collective with a lot more power than the small group that created the system.